We have a wonderful update tonight. Exactly 1 week after we told you about a family in Conroe that lost a critical portion of their Medicaid coverage for a disabled loved one.
Yeah, after we started asking questions, the family got the solution they had been fighting for months.
Stephen Goen has been working this story for us and has the new developments tonight. Stephen.
When we talked to this family last week, they'd already filed appeal after appeal, trying to reverse that Medicaid denial affecting their sister with severe cerebral palsy. Now they're on the other side of this fight, but it was not easy. In nearly 20 years as primary caregiver for her younger sister Lisa, Catherine St. Clair says she never thought the Medicaid support they relied on would be called into question until it was.
Eligibility requirements had not changed. Her condition had not improved. And there was a 12-year precedent.
While Catherine says Lisa needs around-the-clock care, their healthcare provider, Community Health Choice, recently denied 30 hours a week of protective supervision. It was critical home health assistance that Catherine relied on overnight.
The logic that they're using in this statement is illogical. It just is.
However, the day after our story aired, Catherine says officials from Community Health Choice came to her Conroe home to reevaluate Lisa's case. The result, a partial reversal, but a new complication.
I was told on the phone that 30 hours were being reinstated, but that 10 and a half were going to be taken away.
This time, officials said another slice of Lisa's care, 10.5 hours from a different program, would be cut. The issue, questions about who managed Lisa's feeding tube.
They want to nitpick how much time is spent on her feeding routine.
At that point, Catherine wrote a letter to the Community Health Choice CEO. And on Friday, she got a call back from him. So you wrote an email, then you get this phone call. What do you hear?
They felt like there was some confusion. They wanted to clear up some confusion because they think that somebody probably just did the math wrong.
And by the end of that call, Catherine says all of Lisa's at-home health assistance hours were reinstated.
I felt incredible relief. I felt we finally crossed that finish line that we were looking for. And I'll be honest with you, Stephen, I didn't think we were going to win this one.
What do you think changed their minds?
I absolutely believe that the media attention was the catalyst that got us to where we are today. Reached enough people that phone calls were being made and walls were being rattled, and it was because KHOU got involved, and I deeply appreciate that.
Now, with Lisa's coverage fully restored, this family hopes their story helps others fight their denials.
One thing I've learned from this is that there are thousands of people out there that genuinely cared about Lisa, and I know that they care about others too, and I'm hoping that this will start the momentum to get more people to stand up and say, no, we're not going to do this.
And this family does have advice for others in their situation. They say try to find advocates that can help you navigate the appeals process, and whatever you do, they say just don't give up. Back to you.
Yeah, sometimes in these situations it can seem extremely hopeless, but this is just proof to stay the course and keep advocating.
Fantastic. They never gave up. Thanks for the update.